to Freshly Forever, a podcast that gives you fascinating insights week after week. Here's your host, Vai Kumar.
Hey folks, welcome to this special episode on podcast Freshly Forever. Today I have the pleasure of talking to Dr. Kousalya Nathan. She is an expert in adolescent well-being, women's health, and so much more. Hello, Dr. Kousalya. Welcome to the show.
Hi.
So I thought it'll be a great thing to talk about women's health and, in general about gut microbiome, immunity, and all those aspects today. So if you were to just start with gut microbiome, gut health, that is becoming a big talk these days. How significant is it in the present day context, especially in a COVID dominated world? And how can one achieve whatever we call, say, like robust immunity, if you will?
It's a good question again. So I think, very beautifully thing put on gut microbiome because still it's a new topic here in India. I think US has been talking about it for a while, Western world, but here in India, still we have just started to probably talk
I
about
think
it.
even here, maybe the medical circle, has just started, the word is buzzing around. But I think from a patient standpoint or from, a consumer standpoint, people are still not quite aware of what makes up what and what constitutes or helps them to being healthy. So, and like you said, like we always go based on mother's intuition and what the mother fed. So the familial practices, and of course here we are banking on practices of healthy families. Of course, if someone grew up, fortunately or unfortunately, their situation, whatever it was, and they were not used to eating healthy, then they are outliers, obviously, here. But we are talking more from this context. So I guess, you should talk more about gut health and microbiome. And all I was trying to say there was, it's still not, very well known here to people. So I think it's a great aspect to focus on here.
Sure. I think gut health or gut microbiome, I think it is a very important phenomena as we have individual genes, like in the sense like, there is an change in individual genes, like the characters like an individual has, whether the physical features are different and the characters are different, which is genetically probably, different. The similar way, I think the gut microbiome is different and varied from individual to individual. So this is one thing which probably most of them probably are not, aware of, or it's still not kind of discussed so elaborately to the world. The second part here is the gut microbiome. The more healthier you're able to balance, it's about the balancing the good bacteria and the bad bacteria of the gut. Why is it a subject of discussion and is it so complicated is what we all think. In a way, yes, in a way, no, because the gut from the mouth to the anal region is one single tube. It is unlike the joint that we have on the hands or the bones. You have a joint, two bones connection. This is a single muscular tube. That's it. So I think the microbiome, the flora or the fauna that we call it, is very different in the oral cavity. It's very different in the stomach. It's a very different equation of the bacteria in the gut, large intestine, and also very different in the small intestine and in the anal region. So it's not the same. So I think when we talk about gut microbiome, it starts with your oral health. It starts there. How you brush your teeth, how healthy is your gum health, are you maintaining your oral health well? Is your dental appointments being met on time? And is your dentist an integrative dental surgeon? Because now, if they go on the symptomatic basis, I think they are missing out somewhere. It's
Mhm.
really high time that, every system and every field looks at the body in a very integrative fashion or a holistic fashion. It's people, if at all you have a gum disease, how many of them knew it can cause skin rashes? Because if it's a skin rash, you go see a derm and it's done. But
Mhm.
there's internally something not going right in your system, where it could be a fungal growth in your mouth or in your tongue, or it can be some form of a candid infection in your gut or in the stomach or wherever it may be. If there is something related to it, then it can present as urticaria, it can present as skin rashes, it can present as some form of a change.
Mhm.
For that, if you correct your gum health and the microbiome, the oral microbiome is back to normal, I think this vanishes over a period of time. I have seen this in my clinical practice, and now I've integrated dental and gut microbiome in the last probably 4 years. I think the last I visited US was in 2016. And
Mhm.
after that, I think that's a time where now for 5 years I've been intensively working on with all my clients as a fundamental base on gut microbiome.
Mhm.
I think when that is being strengthened, we can bring the best of the apples to your table.
Mhm.
Okay, you can actually eat them. I think that's something we do, but the gastrointestinal system has to break it down, simplify it, process it, take the nutrients, and then absorb it and circulate it into your body for that to have the impact of your nutrients into your system. It doesn't stop by just buying the best organic stuff from the grocery shop.
Mhm.
It's about that getting translated into your body for your repair, for the body's repair, growth, then again, the overall, the well-being, nutritional absorption, and to avoid deficiencies and everything. This is a process that needs to be kind of taken care. So I think it's very important to work on it should start from the oral, gut uh, microbiome. The second is the gastrointestinal part, where
Mhm.
most of the people, because the common problem is not drinking sufficient water, not
Mhm.
keeping them hydrated. When it is dry, when there's a mucous membrane, right? It's lining of a mucous membrane.
Mhm.
Mucous membrane has to be kept moist. There's always a secretion which is there, whether it is the mouth or in the esophagus or in the stomach or in the intestine. There is definitely a kind of moisture which is required. So when there is no enough water being there, then it becomes acidic. When
Mhm.
the body or the stomach becomes acidic, it definitely, as we can understand, that is going to kill the good bacteria. If it becomes
Mhm.
acidic, only the bad bacteria can thrive in an acidic environment. Again, same to do with the gut. The symptoms of improper gut microbiome can be bad, foul smelling. Sometimes you have bad breath.
Mhm.
That's one thing. Or you have some toothache, or there is some coating in your tongue, which can be like a white coating. And then you have bloating and, burping or flatulence sometimes. And then you have constipation, or you feel suddenly that you're gaining weight around your gut, or it could be leaky gut. You have some irritable bowel kind of a, stress related stuff where, the nutrients are getting, washed away from the system. And people on prolonged antibiotics, like, I
Mhm.
mean, if somebody has been put on prolonged antibiotics, that can wash out the gut microbiome as well. And patients on immunosuppressants, patients on, steroids, patients on, not balanced nutritional supplements, imbalances in the supplements, all this can lead to gut health issues. And the gut microbiome imbalance can cause as simple as a headache to as chronic as probably some form of an even a cancer. So it can be a gastrointestinal cancer which is developing. So it can be a simple symptom or can be as acute as that as well. So I think it's very important to take care of your gut health in a very integrated fashion, through, and that can be done only through nutrition, food, and diet, because it's a gastrointestinal system. It is not primarily can be built through popping in pills. It has to be through nutrition. But and second thing is, which we see in the Western world, is too much of cleanliness. You want to be too clean. I think when you're too clean, I think the good bacteria cannot grow as well. You need, I think one of the beautiful slides, I think, which I have seen in one of the presentation is, if you want a good gut health, get dirty. I think it's about, you need to kind of not have too kind of a clean, obsessively clean environment, or keep washing your hands forever and feel psychologically stressed about being too clean.
Yeah,
That
so
factor
okay
is
to
important.
okay to play in the mud, play
Yes.
be connected to earth, okay to walk barefoot. So
True.
all that, and like your skin is a major source of absorption, right? So I guess people don't realize it. I mean, of course, in this COVID world, yeah, washing hands is a big thing. We need to do it. But again, like what you're talking about is being obsessive otherwise, and, like trying to stay, like super clean. It's more
Super
like
clean, yeah.
it's more like a psychological thing than, like anything,
True.
good that we do to ourselves physiologically. What about seasonal eating? Because you emphasized a lot about eating good to be able to build the gut microbiome in the right fashion, right from oral health. So maybe like good tongue cleaning practices, good dental hygiene, brushing, and then washing our mouth and flossing, all that, the dental care as an integrated approach. And you also pointed out about, problems like bad breath and so on and so forth, and how important it is to take care of it and maintaining the alkalinity in the system. What about seasonal eating, and what about immunity? Like we have heard that 70-80% of our immune system resides in the gut. Is that correct?
Absolutely. Absolutely. I think before we move on into seasonal eating, just one more point, which probably I'll add to the previous thing that we discussed, is because with the COVID, we are all wearing masks, where I think with the mask, which probably is not being disposed of, or you need to change every 4 hours, it can again disturb your oral microbiome. So I think now in clinical practice here, we have patients coming in and complaining of, some form of bad breath because of wearing mask. So I think we need to make sure that, what kind of mask is being used and how to discard them and how to change them frequently, because the moisture there when we breathe can also affect the oral microbiome, because that we see here now in India as one of the common problem that I see in practice now in this COVID time. So I just wanted to add that there, that, you need to be cautious, because during even COVID time, there's a very high chance of change in the oral microbiome because of the improper usage of masks, which has not been kind of changed and, discarded. That's one thing which we need to remember. Yeah, sorry if I'm just moving on to this aspect of, seasonal eating and immunogenic foods. I think as our traditional system has been, and I think again I'll go back to the grandmother and mother tale. Probably I may sound very vintage here, but I think our parents were very clear on giving us only seasonal fruits. Because now I go out of way to fetch strawberry from somewhere which doesn't grow here at all. Just because my children like strawberries or blueberries, I think we go out of way to fetch them fancy kiwis and stuff which doesn't belong to our Indian environment at all. And we don't have the season of kiwis at all. So we spend nearly probably in, which is around 200 rupees to Indian rupee for a kiwi, which probably maybe around $2 to $3 in US. But for us here, that's a lot of money, to buy one kiwi fruit. So what I'm trying to tell you is, we have, at least here in Indian environment, have beautiful indigenous fruits and vegetables, which are absolutely seasonal, fantastic, grown in our nearby areas, which can, for example, I live in Chennai, and I tell you, I think around 200, 300 kilometers from here, we have the maximum varieties of mangoes.
Mm-hmm.
I think, why do we have to stop anybody from eating mango? I think we shouldn't. So I think the seasonal fruits, the vegetable, you get this palm fruit, and which we call it ice apple. We have seasonal stuff which comes with season, watermelons, musk melons, all that, with the summer coming in, or then the spring, or we have probably, the humid weather here. So I think certain fruits are available throughout the year, but certain things probably are highly kind of seasonal oriented. It is very, very important to respect nature when it comes to nurturing ourselves. I think the more we respect nature to nurture, I think we are in alignment with our environment. I think if we can bring that into our system, I think that's the best you can do for yourself. I would call it, that's the natural way of pampering yourself.
Back in a moment with our guest on Fresh Leaf Forever.
Pampering yourself is not going out of way to fetch things which doesn't exist. Pampering yourself is having abundance of what's coming into the season, when it comes to fruits or vegetable, or any form of greens or whatever it may be. I think that's a very important part that all of us need to cultivate. There can be a 20% of some intrusion of some non-seasonal foods, but by and large, an 80% of your meal has to be more on seasonal and indigenous. And when it comes to immunogenic kind of immune boosters or immunogenic responses, our best is about having a vegetable juice. It can be, I generally tell my clients that, pull in whatever is there. You don't have to feel, probably nothing fancy. I think food, the simpler it is, it's going to work. The more complicated, the more kind of ingredients or more difficult you make it, it's going to be really difficult. So I think there was a time where people in India were talking too much against rice, which is our indigenous, staple food, rice. But I feel rice is the most healthiest, and idli, which we have, the pancake, the rice pancake, is now declared and accepted by even World Health Organization as one of the safest and the most healthiest food, which is a fermented food. As we are talking about the gut microbiome, these kind of fermented foods gives good, good flora and fauna. The digestion level is so smooth. The absorption is again easier because it's a partially digested food. So I think we need to incorporate whatever is there in the environment, which is there in the culture, to keep our immunity on, rather than completely following the Western world in our nutrition, which probably has caused most of the problem here in our Asian population. It can be diabetes, it can be obesity, it can be hypertension. All those lifestyle disorders is because of the disruption, or we trying to adapt something which probably are genetically not compatible to. I think that bit we need to understand. Similar way in the Western world, like they're used to probably oats, or some form of an millet meal, or a small grain, or an omelette, or whatever it could be, the breakfast, or a bowl of fruits that has to be retained with probably a combination meal for lunch, and then probably a soup or a salad, or some form of a meat for dinner. So I think we need to go with our traditional practices. 20% can be for experimentation. So if we can maintain this, which will be harmonious to our system, then I think our immune system would be pretty strong and very kind of conducive to balance many things over in coping these kind of challenging situations.
Okay, what a wonderful message. Source locally and eat what is grown locally. Focus on what is available during the season instead of, just keeping food simple instead of keeping it complex and going further to fetch it. What about, having touched upon women's health so much? What about premature menopause and menopausal issues? I guess menopausal issues we can maybe even focus separately as a discussion. But what about premature menopause? Is it again a cause of bad eating habits? And what are some areas you would like to see women over the age of 45 focus on to feel best when they have to embrace this change in their lives?
Good. That's a good topic to enter. I think first thing, as you have also done, I think the study and research on this is premature menopause is becoming very common. It is not something now, not something that we can ignore. It's really time that we address it, because many of them doesn't even know what they're going through.
Mm-hmm.
See, you go through menopause when your body and your mind and your environment is not ready.
Mm-hmm.
That's the dangerous thing for a lady or a girl or a woman, because I think that is a time where your estrogen completely falls suddenly. Overnight, your roof falling on your head types. That's the feeling where you start gaining weight. You mentally can't think clear. There's a fogginess in your mind. There's palpitation. You're not able to cope. I think there's so many things which you don't want it is happening. You have a career which is going so good. That's the time where probably career growth is something entering in its peak. So when so many things, and children growing up, managing so many things, then it decreases your sexual drive, and there's vaginal dryness and fungal infections and vaginal, issues, and all those coming in together. It's a traumatizing phase for a lady to go through premature ovarian failure or premature menopause.
Mm-hmm.
Premature menopause is the menopause which sets in between probably 35 to 40 years. Less than 40 years is premature ovarian failure. Okay. Premature menopause is different from early menopause.
Mm-hmm.
Early menopause is the menopause setting in by 45, or little between 40, 40 and 45. That's probably an early menopause.
Mm-hmm.
There is a lot of difference between premature menopause and early menopause. See, premature menopause is absolutely a devastating kind of a situation for a lady, where it's like taking her life out
Mm-hmm.
overnight, suddenly. It can be environmental factors, hormonal disruptors, smoking, alcohol, or popping in too much of hormone tablets, or pills to kind of balance your hormones, or women undergoing infertility treatments can have this kind of an ovarian failure, or it can be some form of a trauma. It can be some sudden distress which could have happened in their mind, is pushing that pressure on the ovarian to stop functioning.
Mm-hmm.
And probably it can also be drastic yo-yoing diets, which can also cause premature ovarian failure. So these are the causes which can happen. The symptoms are very drastic, sudden, and intense when compared to the natural menopause.
Mm-hmm.
So when you compare that, here they have anger, frustration, mood swings, irritability, sleeplessness, hot flashes, sweating, excess sweating, dryness, so many things. It's a packed role of suddenly you feel you're nothing and lost, and you go totally negative in your mind, the approach and stuff. So that's one part of the premature menopause. What I'm trying to tell you here is the early signs to identify. One, if your periods is suddenly becoming a 28-day cycle, if it's becoming a 21-day cycle, it becomes
Mm-hmm.
short cycles, that's an indication of probably an premature menopause or an early menopause. So if there is something like that you identify for 3 consecutive months, please check with your gynecologist on your hormones levels. Please have a gyne check to identify if there is any form of a menopause setting in.
Mm-hmm.
That's the first thing. The second thing is, in case you suddenly feel any of these symptoms, it can be even two symptoms like hot flushes, or you feel night when you're sleeping, you suddenly want to switch off the AC. After
Mm-hmm.
10 minutes, you want to switch on the AC. There is a sudden change and you feel sudden hot, sudden cold. I think if there is a change like that, again, it's better to approach the gynecologist or your GP to have an assessment on your menopausal levels, which stage of menopause you're in. So
Mm-hmm.
then these are the things where you need to address and take help to make sure that you're not setting into premature menopause or early menopause, which can be balanced through some hormone replacement therapy or through nutrition, through probably bioidentical hormone replacement therapy. So all this are the options available which someone can choose from on a safe with a safer environment to opt for. So these things to be addressed, and it is very important that we understand and identify it early so that we can actually have early help and cope with this better.
Anything else like diet and lifestyle, like exercise or nutrition focus, that in general women should, even during the phase that they approach a proper menopause situation, say post 45, like how can they best prepare their body to face that situation?
Yeah, I think one is menopause will have an impact on every woman, come what.
Mm-hmm.
Okay, you cannot escape. It can be thinning of hair, it can be hair fall, or it can be vaginal dryness, or it can be palpitation, or it can be any form of some mood swings or irritabilities. Anything can be there in women which can be identified and stuff. So I think first we need to understand that this is a phase that we would have to cross.
Mm-hmm.
So the only thing is being aware of it. I think the best approaches would be the ideal one of yoga and meditation, about the different asanas, the breathing exercises, and about, calming down your system, sleeping better can really help you cope with that kind of a transition, which is very, very stressful, much better, much kind of easier to take. Second thing is talk to your colleagues about it. There are some women who have difficulty in opening about their menopause because they don't want anybody to know that they are touching menopause, because
Mm-hmm.
it's again like another kind of an where they feel they are losing womanhood the minute they kind of touch
Mm-hmm.
menopause. So they become not fertile zone, so they become less attractive, or they become, people judge them,
Mm-hmm.
if you're menopausal woman, so they feel, they call you old, or they may feel she's a menopausal stage, or whatever you do is at you, it's been tied to menopause. Oh, she's going through menopause, so she's talking this way, or she's going through menopause, leave her alone, or everything is tied to that at that age or that phase. So I think first is the family environment should be understanding, more supportive. That's one part. And the second part, as you rightly mentioned, is to have a good lifestyle. I think yoga, meditation really helps, and eating well, because this is the time where you will be battling a lot of sweet cravings.
Mm-hmm.
So when you have the sweet cravings, where eating too much of sugar, or sugary foods or cola drinks, or you want to have something salty, spicy, whatever it may be, this is a time where you would have to be more kind of rigid, or follow a path of a diet, which is much more comprehensive, much more simpler, with more complex carbohydrate, with a balance of protein, carbohydrate, good fat, and everything, so that there is a holistic component to this dietary stuff, and including more of flax seeds, and you have primrose oil, evening primrose oil. So all those kind of factors are definitely is going to help them in having a better phase to cope menopause. So exercise and diet and sleeping well and yoga, meditation. I think these are very important for till the menopause completely sets in.
Oh, excellent. I think those were great insights, Dr. Kausalya, and thank you so much for taking the time to explain everything in detail to the listeners. And we look forward to catching up with you again in the future. And thank you so much for your time and for being here on the show.
Thank you, Vaidehi, for having me in your show as well. I completely enjoyed, talking to you, and this discussion was absolutely brilliant. And your questions and everything has been well researched and well thought of. Thank you once again.
Oh, thank you so much. Thank you. And listeners, as always, follow the podcast and follow me on Instagram at YP Kumar. I'll definitely catch up with you again with another interesting guest and yet another interesting topic. Until then, it's your host, Vai, saying so long.